for some period of time, it was always thought depression was more of an outcome of Alzheimer's and dementia. And it kind of makes sense, doesn't it? If one is formally diagnosed with Alzheimer's and dementia, you would expect, to some extent, that depressive symptoms may increase because of that. However, good epidemiological research has emerged over the years that really has, I think, disentangled the temporal relationship between depressive symptoms and Alzheimer's, where in fact, depressive symptoms, the symptomatology is certainly a risk factor for later life dementia. And it kind of makes sense in that if one is depressed, will probably be less likely to engage in many of the healthy lifestyle behaviors that Dr. Salisbury had discussed, and is probably at risk for a number of other negative lifestyle factors that could also contribute to dementia. One thing really to emphasize here, and I think we as scholars sometimes miss this because we tend to be so focused on this strategy and this intervention and identifying this singular risk factor, is in fact, all of these risk factors are highly interactional. They likely combine in very complex ways to contribute to dementia risk. So that, number one, is very important. And number two, I don't think we know very well what would, say, for example, long-term use of antidepressants, will that actually contribute or perhaps maybe mitigate risk for dementia? I mean, it could be one or the other. I don't think we really know that answer very effectively. And I think you could make a compelling hypothesis or case for one or the other.